Is this highly contagious variant a signal of the end of the pandemic or a sign of worse to come? What does the more rapid spread mean? How effective are the treatments? Find out here. Viruses are mercurial by nature. That's because a virus survives by attaching to a host, where it proceeds to reproduce itself over and over. However, changes, known as mutations, often happen during that process. Mutations that end up being advantageous to the virus's survival are more likely to be repeated.
But life, finds a way.
As of April 2021, the novel coronavirus already had 12,700 identified mutations and almost 4,000 variants. Obviously, not all variants and mutations are considered to be of consequence to public health. The ones that are, though, are referred to as variants of concern, or VOCs. They are defined as a variant for which there is evidence of an increase in transmissibility, more severe disease, significant reduction in neutralization by antibodies generated during previous infection or vaccination, reduced effectiveness of treatments or vaccines, or diagnostic detection failures. To be declared a VOC by public health authorities, a variant must be found to satisfy all of these unfortunate conditions. On November 26, 2021, the Omicron variant was officially classified by public health officials as a VOC. From the time it was first identified, the Omicron variant already showed signs of being extremely transmissible. During the first 2 weeks after the variant was identified in South Africa, cases rose from 300 to 3,000 per day. By late December, it had already become apparent that Omicron can and does spread to people who have been fully vaccinated against COVID-19. It has also started infecting those who have already had COVID-19. All such people can, in turn, spread it to others, whether or not they experience symptoms. Dr. Anthony Fauci, chief medical advisor to the president, said, "Omicron, with its extraordinary, unprecedented degree of efficiency of transmissibility, will ultimately find just about everybody. For those who have been vaccinated, the odds of hospitalization and/or death should be reduced." Scientists are still trying to understand why the Omicron variant is so proficient at spreading so quickly throughout larger populations. Possible reasons include the high number of mutations that have been identified in the Omicron variant's genetic makeup, many of which are associated with enhanced transmissibility. In addition, it has been observed that Omicron multiplies particularly rapidly and builds to particularly high levels, as compared with the Delta and other variants. When COVID-19 was first identified, scientists studied its apparent incubation period and concluded that after exposure to the coronavirus, it took at least 5 to 6 days for symptoms to present themselves. A 2020 study published in the journal Virulence found a correlation between incubation speed and disease severity in COVID-19 patients. However, that was many mutations ago. Since then, each of the major VOCs has come with a briefer and briefer incubation period, regardless of degree of severity. When the Delta variant was identified, the period was estimated at 4 days. As for Omicron, European researchers have suggested symptoms can appear, along with contagiousness, within as few as 3 days of exposure to the virus. Some experts believe the Omicron variant's compressed incubation period may contribute to its ability to spread so efficiently. According to Johns Hopkins epidemiologist Jennifer Nuzzo, the brief window between exposure and infection makes Omicron, quote, much harder to control as compared to other variants. Since the time that COVID-19 was first identified in 2020, its incubation period has been cut almost in half. As a consequence of this increasingly abbreviated incubation period, communities around the globe are facing an increased number of COVID-19 infections at any given time. The rapid spread and the shortened window from exposure to infection pose new challenges with regard to testing. That's because the less time it takes to go from exposure to development of a viral load significant enough to cause symptoms, or in asymptomatic cases to become transmissible, the smaller the window for meaningful testing. Adding insult to injury is the fact that PCR tests can take several days to come back. Rapid testing, which can return results within minutes, may help, but they are not nearly as accurate as PCR tests. Specifically, they may not always be able to pick up a COVID-19 infection at its early stages, even when the infection is already contagious. Making matters worse, the speed at which the Omicron variant spreads means that more people are seeking out testing, with the result being that demand has been significantly outstripping supply. COVID-19 is, by definition, a severe acute respiratory syndrome. The CDC notes that regardless of variant, the symptoms of COVID-19 can include fever, cough, fatigue, body aches, shortness of breath, headache, sore throat, a loss of sense of taste or smell, nasal congestion, and gastrointestinal distress, as well as many others. According to the CDC's Mortality and Morbidity Weekly Report for the first week of December, the most common symptoms were cough, fatigue, and congestion or runny nose. A December 16th research paper published in Eurosurveillance identified the most commonly reported Omicron symptoms as cough, runny, stuffy nose, fatigue, and sore throat. Slightly less common were headache and fever. Even more uncommon were a reduced sense of smell and a reduced sense of taste. By contrast, when first identified, COVID-19 presented most often with fever, cough, and a loss of sense of smell or taste, according to a 2020 study published in OTO Open. What the scientists could not tell, however, was whether these differences might be attributed to positive vaccine status. Many people who have tested positive for the Omicron variant have observed that their symptoms have been relatively mild. This may be, at least in part, a function of where Omicron tends to settle in the respiratory tract. Whereas earlier variants tended to settle in the lungs, Omicron appears to affect primarily the upper respiratory tract, or the nose and throat. This has invariably led to confusion, with some people inaccurately believing that Omicron isn't something to worry about.
No big deal!
While it is true that a smaller proportion of people who become ill with Omicron have ended up hospitalized or worse, hospitalizations and deaths continue to mount. And while many who have tested positive for Omicron have reported mild symptoms, it's not entirely clear if it's because it has been impacting a younger, healthier demographic. Or perhaps it may reflect that many people are experiencing mild symptoms because they are vaccinated against COVID-19. Dr. Tedros Adhanom Ghebreyesus, Director General of the World Health Organization, said, "While Omicron does appear to be less severe compared to Delta, especially in those vaccinated, it does not mean it should be categorized as mild. Just like previous COVID-19 variants, Omicron is hospitalizing people, and it is killing people." By January 12th, the Omicron variant was already accounting for 98% of all new COVID-19 cases, according to the CDC's Dr. Rochelle Walensky. But Omicron is not the only variant that is currently responsible for hospitalizing Americans. Indeed, Walensky has said that the majority of COVID-19 deaths are still coming from Delta as opposed to Omicron. However, it's hard to say what the future holds, including the potential for Omicron to lead to long COVID. Dr. Ziad Al-Ali of a St. Louis healthcare system who studies long COVID told Helio, "What we know about long COVID so far, from all the prior variants, is that the severity of long COVID seems to be a function of the severity of acute illness. What we have so far learned about Omicron is that it tends to be milder or a little bit less severe. This is, of course, the good news everyone has been latching onto." However, he continued, "I'll caveat that by saying that we're also still learning about Omicron. Maybe in the next few weeks, we'll learn that death rates will go up. Hopefully, that's not going to be the case. But so far, our knowledge is that Omicron seems to be a bit milder than Delta, and if that really holds, it may translate into less risk of long COVID." Throughout most of the pandemic, it's been taken as a given that if you've been diagnosed with COVID-19, you will have a lowered risk of subsequent infection for a period of at least 6 months, thanks to your immune system having built up ammo against COVID-19. However, according to Dr. Thomas Russo, a professor and chief of infectious disease at the University of Buffalo in New York, one of the key features of Omicron is that it's much more resistant to immunity, whether vaccine-induced or caused by previous infection. Contracting COVID-19 after you've already had it is known as reinfection, as opposed to immune escape, which is the term for infection after vaccination. Dr. Stanley Weiss, professor at the Rutgers, New Jersey Medical School and the Department of Epidemiology at the Rutgers School of Public Health, told Prevention, "Yes, you can get Omicron twice." According to Dr. William Schaffner, an infectious disease specialist and professor at the Vanderbilt University School of Medicine, one reason may be the increased viral load that has been associated with Omicron. In November 2020, the FDA granted emergency use authorization to Regeneron's monoclonal antibody treatment for people at high risk for severe COVID-19. Monoclonal antibody treatment involves an intravenous infusion of lab-grown proteins that mimic a healthy immune response in the presence of harmful pathogens. Unfortunately, supply chain issues limited the number of people with access to monoclonal antibodies by December. Then, when clinical studies began suggesting these therapies might not be effective against Omicron, the U.S. paused distribution.
Late today, the FDA said Regeneron and two other treatments often used together are ineffective at battling the Omicron variant.
On January 24, 2022, the FDA subsequently revised the EUAs for Regeneron and other similar EUAs, confining their use only to those who are suffering from variants that respond to such treatment. However, the FDA explained, importantly, there are several other therapies that are expected to work against the Omicron variant and that are authorized or approved to treat patients with mild to moderate COVID-19 who are at high risk for progression to severe disease, including hospitalization or death. The CDC notes, current vaccines are expected to protect against severe illness, hospitalizations, and deaths due to infection with the Omicron variant. However, the organization continued, breakthrough infections in people who are fully vaccinated are likely to occur. With other variants like Delta, vaccines have remained effective at preventing severe illness, hospitalizations, and death. The recent emergence of Omicron further emphasizes the importance of vaccination and boosters. COVID-19 vaccines do indeed appear to be helping prevent deaths and hospitalizations, all of which have gone down as more people have become vaccinated, despite the number of cases continuing to rise due to Omicron. So it goes without saying that scientists and doctors largely agree that vaccines are the best tool we have to fight COVID. And it looks like that tool is on its way to acquiring some additional sources of power now that both Pfizer and Moderna have officially thrown their hats into the ring with regard to developing an effective Omicron-specific vaccine and booster, respectively. On January 25th, Pfizer, together with its partner BioNTech, commenced a clinical study on the safety and effectiveness of its prospective vaccine. The following day, Moderna began testing its own prospective booster. Pfizer expects to publish results from its study during the first half of 2022. As of the making of this video, Moderna's timeframe is not yet known. They say that those who ignore history are doomed to repeat it. In keeping with that sentiment, many are taking the time now to reflect on the 1918 flu pandemic. Like the COVID-19 pandemic, it claimed the lives of millions around the world, an estimated 50 million. But by the dawn of the Roaring '20s, the pandemic had pretty much run its course. Some infectious disease experts, including Dr. Keith Armitage, attribute the conclusion of last century's flu pandemic to both herd immunity and the virus mutating to become less severe. Of course, that all took place over a period of around 2 to 3 years, and, in a sense, vestiges remain even to this day. Still, some experts believe that Omicron, with its extreme and rapid transmissibility and the possibility that it may prove to be less virulent than earlier variants, could be a harbinger of the end of COVID-19, at least as a pandemic as opposed to a fairly routine, fairly controllable virus. Virologist Dr. Rodney E. Rohde explained to Healthline, the 1918 influenza virus eventually mutated to the point of not having a high number of deaths. We may very well be witnessing this process with ongoing variants of SARS-CoV-2. However, Rohde refrained from making actual predictions because there is simply too much uncertainty at this time. Check out one of our newest videos right here. Plus, even more Health Digest videos about COVID-19 are coming soon. Subscribe to our YouTube channel and hit the bell so you don't miss a single one.